Good evening and thanks for staying tuned. Welcome to our COVID-19 update at this hour. I am Ladi Akiriduluale. Here are the highlights at this hour. Federal government appeals to state governors on harmonization on easing lockdown guidelines, reports low compliance levels on day one. It's also low compliance levels for guidelines in public transportation in the nation's commercial capital, Lagos, on the first day of the lockdown easing. And the United Kingdom is to test COVID-19 contact tracing app in the Isle of Wight from tomorrow. It's the first day of the easing of the lockdown order, but the Presidential Task Force on COVID-19 says the compliance level is unsatisfactory, especially with social distancing as well as the use of masks. At the briefing of the task force in Abuja today, its chairman, Mr. Boss Mustafa, explains that the PTF has been monitoring the compliance level since the morning of today. He especially singled out crowds at banks and advised that enforcement agencies should carry out enforcement rigidly, while violators will be prosecuted.
The Presidential Task Force has been monitoring the level of compliance with some of the measures, and early observations showed lack of compliance with social distancing and wearing of masks or cloth coverings. We note particularly the chaotic scenes around the banks and other financial institutions. We must reiterate that the danger of infection is not over, and that individual actions will contribute to the success or failure of our measures. We urge citizens to minimize the risk of getting infected while trying to transact in the banks. We similarly urge the banks to ensure that their ATM machines and online banking systems are in good order and stocked regularly to avoid convergence of customers in their premises. The PTF fully understands the desire of Nigerians to come out to continue their lives after 5 weeks of lockdown. State governments and security agencies have, however, been advised to enforce the measures rigidly, and violators will be prosecuted.
Meanwhile, the Minister of Foreign Affairs says the federal government is to commence evacuation of Nigerians living abroad from Wednesday. According to Mr. Jeffrey Onyema, there are almost 4,000 Nigerians who wish to be evacuated, but bed spaces for them is the biggest challenge. He hopes the first flight, Emirates, will be to Lagos, while a British Airways flight coming to evacuate its citizens will be bringing in about 300 or so Nigerians from the United Kingdom. Mr. Onyema also gave an assurance that the federal government is in talks with the U.S. to evacuate Nigerian citizens there.
There are about almost 4,000 Nigerians wishing to come back home. If we had our way, we would bring them all back immediately and all at once. But there are various constraints, and the biggest constraint is where to quarantine them, the beds. So we've done everything we can to get beds here in Abuja and in Lagos. So the first flight that we hope by God's grace to have on Wednesday, Emirates, will be to Lagos. Then we're hoping that soon after that, a British Airways flight that is actually coming to Nigeria on Friday to evacuate some British nationals here in Nigeria. Since it will be coming empty, we've negotiated with the British government for us to fill the plane in London with Nigerians coming back. Ideally, we would have liked that flight to be coming to Abuja because we have been able to secure more hotel rooms in Abuja than we have in Lagos, almost 1,000 in Abuja. But they've let us know that unfortunately that plane cannot come to Abuja, that it's only Lagos. So it's going to be put quite a strain on our capacity.
Foreign Affairs Minister Jeffrey Onyema. I'm being joined in our studios here by public health physician, Dr. Adiola Owolabi. Good evening. Thank you so much for your time. Well, it's day one. Let me begin by asking, what's your general impression in terms of the easing of the lockdown? What are the reports that you're getting, and what did you yourself observe?
I was able to go out today and observe what people were doing. I would say it's too early to ease the lockdown because people are not complying with the general precautions. You know, it's a disease that has come to disrupt habits and behaviors in people. So compliance level at this level is still low. So the general observation is that people are not really complying with the general precautions.
If one takes that, I mean, from in terms of the PTF observations and then from the observations of those, they would seem to align largely with what you've talked about, which is that the level of compliance is extremely low. But there are those who have argued that that was to be expected on day one, that people who had been locked up for more than 4 weeks would all want to come out, even those who didn't have much to do. They'd all want to exercise that freedom. But having said that, given what you've observed about the compliance levels, going forward now, should we be introducing some other form of compliance, so to speak, in order to enforce this?
Okay, like you said, enforcement will be needed at this time because, like I said, it's a disease that has come to disrupt habits. People are used to certain ways of life, and now you're telling them to observe other patterns of living. It is expected to enforce it. Over time, it becomes part of them. But at this early stage, I still expect people not to comply.
Going forward, Kano remains a very sore point. A lot of people keep pointing their fingers in that direction, particularly as an example of what can happen when community spread begins to really take root. A lot of people have spoken to the fact, in fact, at the PTF briefing today, the Minister of Health talked about 80% community spread. Now, that's some of the reports that are being received. With what you've said now about the non-compliance, could this be possibly replicated elsewhere now that people are free, so to speak, to go to work and go to other places?
Yeah, bringing Kano to fore, I would say this is a time to put sentiment and bias aside when addressing this issue. Because now, people are not complying in Kano, and we are seeing the rapid surge and increase in number of cases in Kano. So like I said, drastic measures need to be put in place, put aside.
Like what? When you talk of drastic measures?
Now, like the social distancing we've been talking about, we can see that it's not really being observed in Kano, you understand? And government really needs to take drastic measures to ensure that the citizen stays at home and to ensure that all other measures being put in place are also complied with.
Do you fear that if there is a deluge of cases, health workers like yourselves and the facilities that we have might be overwhelmed?
Yes, I foresee that happening because the health system is going to be overburdened by cases that will come in. And we must also realize that this is an occupational hazard to health workers. So health workers themselves are also being exposed to this risk. And if you're talking about facilities, we must also talk about the health workers there. So if more health workers are being exposed and they are coming down with COVID, then what do we face? It's a disaster in waiting, which I pray shouldn't happen.
In the nation's commercial capital, we'll come to that report in the course of the program, there's also this problem of physical or social distancing and compliance with the rules, particularly of public transportation. A lot of those who went out observed that it's almost like it's business as usual for the public transporters. Again, another source of possible problems
Yes.
going forward. What do we do? Because I'm sure some of the administrators will ask themselves, beyond what has been done, advocacy, trying to appeal, making people see this from their point of view, the advantages for them and so on. What else can be done?
Well, at this moment, I feel those offering essential services should be the one on the road. And really, we are talking about the road transportation. We are not talking about the waterways. Are we sure that people are not using the waterways? Are we sure that people are not using the rail system interstate? It's only the people offering essential services at this time that should be out there. People can work from home. People have been doing that, and we see that it's working. So let's adopt this for now. Let's limit the number of people out there, and this is going to help us.
But the whole essence with the lockdown, you can see some of the visuals. These are what was going on today, earlier on today. If we didn't know anything about COVID, this would have been just another day in Lagos. And yet, this came after 4 weeks, 5 weeks of constant awareness and people being told to stay apart, wear their masks and all of that. Yet, this is what, of course, here, this is the government-approved public transport system. This is the BRT system. A bit more order here. But very few people, in terms of percentage, are able to follow through with this. So, again, we're going back to what we have, what will essentially be a problem for us going forward. And that's why I ask you, what do you think can be done? From what I'm getting from you, you think we should go back to the lockdown?
To the lockdown. I strongly support the lockdown because it's too early to ease it. You understand? Like what you just showed a while ago, it's showing that people, what I saw today, it was just like business as usual. You understand? So to help the citizens, maybe people don't understand the implication of their actions and their inactions in a way. So at this time, government should still extend the lockdown, in my own opinion.
That doesn't seem to be on the cards at the moment. The other thing I wanted to ask you about is the cases. From Friday, Saturday, Sunday, up until just yesterday when we had a reduction in the number of new confirmed cases, it was all the way up. First you had 195, 196, 204, then 238, before it then came down to 170. And yet that was before we eased the lockdown. My question earlier about overwhelming the public health services. I must go back and ask you, even if we go back to the lockdown, even if we lock back down, how do we avoid the potential difficulty that will come from non-compliance?
Okay. We need to understand that in addressing issues like this, we need to step up our surveillance, you understand? Then disease notification, we need to step up this. Then we also need to go to the secondary level of curbing this, which involves screening, increasing the number of people that are being screened. Then the positive cases, we must try to separate them or isolate them from the general population so as to prevent spread. And lastly, those who are positive, we must also treat them and rehabilitate them. So having observed all of this, we will be able to fight it and combat it.
Thank you very much, Dr. Adeola Owolabi,
for
joining us at this time. We hope that some of those fears you've expressed do not come to bear and that people will take more care as we proceed at this time.
Thank you.
We are now going to our Kano studios where we're being joined by our correspondent Idris Jibrin. Kano is what is on virtually everybody's lips, Idris, and We learned now that your lockdown has been relaxed, even if for a few hours. But the reports are conflicting. Some say you now have 2 days off, Mondays and Friday, when there will be no lockdown. But before we get to that, first of all, what was the level of compliance today?
Well, thank you very much, Ladi. The level of compliance today as regards to easing of the lockdown, I must tell you that hundreds, or let me say thousands of people came out today to go to the markets and other places for shopping. So the level of compliance in terms of coming out regarding the easing of lockdown was massive. People turn out en masse. In fact, the hold-up in Kano, it's something that you don't really want to see. Hundreds of people turns out for buying. And the lockdown is actually Monday and Thursdays, not Friday. So from 10 a.m. to 4 p.m., people can go out and do their shopping and do whatever they want to do, go to the markets and other places and banks on Monday and Thursdays. But the level of compliance, people turned out en masse. But when we are talking about the compliance of lockdown, actually a lot needs to be done in terms of that compliance of restriction of lockdown. Because I have seen so many places, this lockdown, people are really defining it in Kano, especially in some of the streets within the residential areas. You will find out that people are not actually complying. They are moving freely, doing their normal activities. But even on the streets, you will see that not everywhere this total lockdown compliance is being observed in Kano State, which means a lot of things need to be done. Even today, the state governor was lamenting that people must adhere with this instruction, and they must comply. They must stay at home during the period of lockdown. They can only come out on the days that were allocated for the ease of the lockdown. But I must tell you that in some places, people are not complying with the lockdown, and in terms of easing of restriction, thousands of people are coming out to do their shopping and normal activities in Kano.
We are hearing reports, there are some reports that tend to indicate that the mystery surrounding some of those mystery deaths that were talked about last week may have now been resolved. Can you tell us anything about that?
The conflicts, come again?
I said we're having reports about the mystery deaths that were recorded last week, the deaths that were recorded last week, that there was some doubt over what exactly caused those deaths in Kano. But there are some reports coming out today indicating that that mystery is over, that what caused the deaths is now known. Is that true? Do you know anything about that?
Well, yesterday, the chairman of the presidential task force that was sent to Kano, Dr. Gorzo, during an interview with newsmen, confirmed that preliminary investigation reveals that most of these mass deaths that are being recorded in Kano are linked to coronavirus. He went further to state that unless Kano people started to take this COVID-19 issue seriously and started to believe that COVID-19 is actually real, Kano State may be at risk of recording more cases. He said, truly, from what they have conducted so far, from the preliminary investigation they have conducted so far, it's obvious that the mass death is actually related to COVID-19. This is coming from the chairman of the task force that was sent from Abuja, Dr. Gorzo. He said it, he confirmed this yesterday during an interview with newsmen. But then they are waiting for the final reports to make a comprehensive report regarding the mass death. But from what is coming from him, he confirmed to newsmen that there is indication, the autopsy they have conducted, it's indicated that the mass death is actually related to coronavirus.
All right, then. Thank you very much, Idris Jibrin, our correspondent Idris Jibrin from Kano City, from our studios in Kano. We'll take a break at the moment. When we return, we'll go back to the nation's capital to find out what happened there today, first day of easing after lockdown. Please stay on with us. Thanks for staying tuned. Welcome back. In the nation's capital, residents are struggling to comply with personal responsibility rules as the easing of the lockdown takes effect. In the suburbs, as well as the city center, there are large crowds in front of banks. There was overloading of taxis and buses while many people were not wearing face masks. Our correspondent Kayla Megwa reports.
Abuja is dealing with what can be described as teething problems following the ease of the lockdown. At 7:30 a.m., traffic is building up at the Kubwa Expressway. Traffic is back at the Duse Alaji area, while law enforcement agents discharge passengers in taxis not observing social distancing. At the Gwarimpa area, people walk around without face masks as commercial drivers overload their vehicles with passengers.
Why we don't wear them before? Too much this thing. I'm protected. I'm covered.
I feel safe because if you keep the rules and regulations people on the ground, you are safe.
You're not supposed to release while every day we keep seeing the number increasing. You're not supposed to allow it to relax the lockdown.
In Nyanya, the situation is worse. Huge crowds at the bus stops signify the return of the early morning rush. Many ignore the order to wear face masks in public.
People are going out without face masks. If you look at this, the commercial workers, some of them, they don't wear face masks. Even the bus, the passengers from here going to town without face masks. What do you expect the government to do?
I feel we should be at home to preserve ourselves, to prevent ourselves from the disease. But the need for us to have a source of income, to work and have a means of survival is very important.
In Lugbe, it's the same story. Crowded bus stops, no social distancing, and people without face masks are on the road. The residents are happy to be going back to work.
It's not been easy staying at home all this while. So at least we are resuming work today. The economy will begin to creep back gradually.
Honestly, as for me, as a health worker, I have been going to work. So today, is not an exceptional. So I have been going to work. I'm also happy that others are joining me in the workforce for today. So I feel great.
In Garki, the banks are adhering to the order not to have crowded banking halls. But the social distancing while customers wait their turn is non-existent. The days of the lockdown should have prepared residents for the new norm following the COVID-19 pandemic. Hopefully, this disregard for personal responsibility will not make the government rescind its decision to ease the restrictions. Kayla Magwa, Channels Television News.
Kayla Megwa now joins us from our Abuja studios. Kayla, you said this might be teething problems, but from your reporting all month long, this has been more or less the story, even when there wasn't this easing of the lockdown. So are people really taking this personal responsibility thing seriously?
Good evening, Ladi. I have to tell you, the answer to that question is no, they're not. This pandemic has disrupted. I was listening to your guest earlier, and he's absolutely correct. What this pandemic has done is disrupt what people are used to. So I think maybe many people think this is going to just go away, or it's not serious. I don't know what really is going on, but something needs to be done for people to really understand how serious this situation is. The easing of this lockdown has been very controversial, Ladi. Why was the lockdown eased? So people can go, make some money or, go to work. is at the risk of putting their lives in danger or infecting other people. So what does that say to the people? What's the government saying to the people by making that decision? I think that's a conversation that I see going on everywhere, really, even on social media. So what does that message say? Because what happens is when there's a pandemic, you make sure everybody stays away from where they can get infected or infect other people, and you provide palliatives, which is why our conversations in the past few weeks have been about palliatives, 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 because they need that to be able to stay indoors. So by telling them to go outside, is the government saying, we can't provide you palliatives, go fend for yourself, at the risk of getting yourself infected? So it's a very serious problem, Ladi, and we're seeing this everywhere in the nation's capital. I call it teething problems because it's the first day. I'm hoping that things will get better, but something needs to be done for people to understand how serious the situation is. Easing the lockdown isn't the problem. The problem is that the easing of the lockdown came with conditions, and those conditions are not being met. So what are we going to face for not meeting the conditions that we're supposed to meet as a people? Social distancing, wearing face masks, being conscious of it. There's a lack of consciousness of what the problem is, and I think something needs to be done about that, Ladi.
Going forward, the question of enforcement then comes to mind. All along, we had the debate over enforcement, particularly in Abuja. So many people exempted, so many people flashing all kinds of ID cards and all of that to get past checkpoints. Now, officially, there's an easing down, but as you point out, there are guidelines to this easing down. Did you notice any form of enforcement of those guidelines to at least put the people on notice that this is important?
At the Duse axis, I saw that. I didn't see it at Gwarimpa, I didn't see it at Lugbe, and I didn't see it at Nyanya. But at Duse, Duse is near Kubwa, is one of the suburbs in the nation's capital. I noticed that the Federal Road Safety Corps were there. And what they were doing was they were looking into taxis. And if a taxi is not observing social distancing, in other words, if it's overloaded, they would stop the taxi, get everyone to alight from it, and then they'll take the car away. So I noticed that only at Duse Alaji today, but I didn't see it anywhere else, which is also very troubling. We're looking at community spread here. So the communities have to be checked. There has to be more enforcement in the communities. Of course, the argument is there for the lockdown to be, for this lockdown easing to be rescinded. This decision should be stopped. Many people are saying, no, we're not ready for this. But we cannot be in a lockdown indefinitely. The important thing is that people have to be able to adjust to the new norm. And yes, you are absolutely correct. Law enforcement has a very strong role to play here. Now, on Sunday, we were talking to the task force, the chairman of the task force in Abuja, and he was saying, look, we cannot just continue to enforce rules. We have to appeal to the conscience of people. They have to understand what's going on and be a part of the process. So it doesn't feel like government is trying to stop you and you're trying to gain your freedom. No, you have to understand that we're in this together. So that particular divide, Ladi, has not been sorted out. And as long as that isn't sorted out, every day we will go and we will check compliance levels and they will constantly be low because people feel like they are away from the situation, Ladi.
Our correspondent, Kayla Megwa, thank you so much for your reporting, and do stay safe as we continue to do that. We come back to Lagos, the nation's commercial capital, where the month-long lockdown was officially eased today, and many residents went out of their homes for the first time in weeks. Our correspondent, Dari Dowu, reports that the level of compliance to the guidelines set by the government was quite low.
Commuting in Lagos through the public transport system comes with its own headache, and with COVID-19, the concerns appear to be rising. The government is mandating the use of face masks in public, and interstate travel is banned as part of the public safety measures. But here at Bega, the entry point into Lagos, commuters seem to have a way around beating the directive. The buses end the trip here for passengers to walk through the police blockade set up a few meters away. Ensure provision of hand sanitizers to all passengers, reduce occupancy to maximum 50% of usual capacity, the guidelines stipulate, among other measures. Strict measures to contain the spread of COVID-19 have been in effect since late March when President Muhammadu Buhari announced the lockdown order, and economic activities have been shut down since then. Now, to restart that process, the Lagos State government has released a set of guidelines which is expected to contain the spread of the virus at the community level. But are commuters and transport operators observing these measures? The mass transit service BRT run by the state government has been directed to cut the number of passengers to 20 with some other safety precautions.
This is my first time of coming out for the past 5 weeks. I believe that BRT is more conducive, more especially as the governor has said that the BRT will carry 20 people. So I feel it's more appropriate that I use the BRT.
Social distancing appears to be distant, especially for the yellow buses. They load full capacity, and avoiding physical contact becomes difficult as seen at different bus stops and parks. These officials of the Lagos State Ministry of Transportation are on the road to ensure that people comply with the safety rules set by the government. For tricycle operators, the current arrangement is good for them and their passengers.
This is working because of the Okada people is not working. Most of them are carrying Okada 100 naira before. So they even appreciate that they see Marua and they have a social distance inside the tricycle.
The heavy economic cost on the country necessitated the decision of the government to ease the lockdown, and authorities are appealing to residents to comply with the measures in place to stop the spread of the virus. Dari Idowu, Channels Television News.
From that report, we can go to our correspondent, Olu Phillips, who is in the Berger area of Lagos, which witnessed a great deal of traffic during the course of today. Good evening, Olu, and glad to see you at this point in time.
Laddie, good to see you again. It's another week and a different week altogether from what we've had in the last 4 weeks, because it's the first time in 4 weeks or thereabout that we are having resumption of activity. And first of all, let's say the way it is. It's already past 8 o'clock and it's already past 9 o'clock. And if you look behind me, you can see the first set of people who have been caught in that web of the curfew, which was announced by Mr. President that it will start 8 p.m. every day. Incidentally, you begin to ask yourself, why did people get themselves caught in this web of the 8 p.m. curfew, which is supposed to last from now to 6 a.m.? What's going to happen to these people? We're not very sure, but this is the situation here. And it's been like this all day. The traffic situation has been very terrible, especially at this axis. And now that's because this is like a border control area between Lagos and Ogun State. Now, the Ogun State government and the governor has received a lot of flag. The color of that flag is not green. It should be red, because the man is obeying the national strategy, which says no in, no out. But again, we have people who live in Ogun State and work in Lagos State and have to commute between these two states. That's where the confusion is. And it seems like a lot of people, too, did not make an adequate arrangement to accommodate the timing. For instance, in Lagos, it said that you should work between 9 and 3 p.m. so that before then and 8 p.m. you can get home. But we're not sure that's what has happened here today and what has happened across Lagos, especially the bridges, Echo Bridge, the Third Mainland Bridge, the stretch of the Ikorodu Road. Everywhere was jammed today. Central Business District area was also busy. The non-formal sector guys, everybody hustling, and it doesn't seem like anybody obeyed the social distancing thing as far as curtailing the spread is concerned, Laddie.
As we leave you, Olu, you talk about the people who are having to leave. Very quickly, what are you being told by those who have kept them from moving? Are you being told anything?
You know the way the security men operate rather, they just obey the last instruction. The instruction is to say, if you don't have any business getting out and getting in, then you shouldn't even be at the border area. And so managing that difficulty for those who have already gotten to that border point is where the confusion is, because there are some people who are genuinely should be on the road. But the security operatives here tell us Those who have no business around this border area are already crossing and causing a lot of gridlock. And that's the situation here at the Bega area, Ladi.
Thank you very much, our correspondent Olu Phillips reporting there from Bega, the border point between Lagos and Ogun states. Let's quickly touch base with the website of the Nigeria Center for Disease Control, the NCDC, to see what the country's COVID-19 figures look like. The total confirmed cases currently stand at 2,558. Of this figure, 2,071 are the active cases because 400 COVID-19 patients have been discharged from across the country. Sadly, 87 people have also died from the disease. A look at the cases region by region shows that Lagos has the highest in the southwest with 1,107 cases. Kano leads in the northwest with 342 cases. In the north central, the FCT has the highest number with 278. Gombe has the highest number in the northeast with 96. Edo State has the highest number in the south-south with 52. And there are 8 cases for Enugu State, making it the highest in the country's southeastern region. We go back to Abuja now, where we are being joined by a virologist who is also a medical laboratory scientist, a member of the West African Network for TB, AIDS, and Malaria, Dr. Akiala Ishaku. Good evening, Dr. Ishaku, and thank you for your time.
Good evening, Ladi.
What do you make of day one today? What has been your impression of what has happened in the various sectors today, the first formal day of the easing of the lockdown?
I can categorically tell you that the compliance level is 0. And this is because, as a nation, we underestimated the reactions of Nigerians. And Nigerians have exhausted their capacity, and so they have to react. And so what I expected is that I did not expect full compliance. This is because even the framework for our enforcement is chaotic in nature. And you know that by default, as a country and as a people, we are not a disciplined nation. So what I saw today was just an affirmation of my assumptions that the level of compliance is 0. That brings to bear that we have to look at the causal factors, which to me, I can term it into 3 factors, which is poverty, which is lack of transparency in governance that leads to our decayed infrastructure, because you can't lock down people and then you cannot be able to provide the basic needs for them. And also, the third factor, which is the causal factor, is the level of education. So by and large, these are the causal factors that we need to look into and not the leading factors. So I expect by now we should be able to have community surveillance system in place. I was also thinking that we can have COVID-19 community marshal, where we can revitalize our community health extension workers that can be able to go into communities and begin to do community communication or public health community communications. I was expecting that we can be able to have this co-marshal, COVID-19 surveillance marshal, that can be able to identify people that are in need, essential needs of commodities, and then we begin to attend to them and begin to give out palliatives. I was also expecting that our banks can be able to devise strategy that we can be able to maintain social distancing. So what stops our banks from making people to have appointment through their apps? What stops our banks from creating a framework that people can be able to text their account number with a code, and then they get an appointment time for them to be able to get access into the banks? What stops us also from having mobile ATM machines where we can also be able to maintain social distancing? By now, I'm expecting that we should have mobile ATM where people can be able to withdraw their monies and also be able to deposit their monies. So this, by and large, we need to come up with a framework. But as a people, we are not a disciplined nation. So I expect zero compliance. Ladi, let me assure you that if we ease this lockdown, we are going to have an exponential rise in the number of cases of COVID-19. So because we have created an ecosystem to drive this process.
Dr. Ekela Ishaku, because of our time, unfortunately, we're going to have to leave it there. Thank you so much for your time this evening. We'll, of course, invite you back at some other point to expatiate on this and some of the other issues as we gradually monitor the gradual easing down of this lockdown. Thank you once again for your time, Dr. Ekela Ishaku from our Abuja studios. We'll take a break, and when we return, we'll go outside our shores and check out what's happening. Please stay on with us. Thanks for staying tuned. South Africans working in a number of sectors returned to work today in accordance with the eased lockdown regulations now at level 4. President Cyril Ramaphosa was part of today's virtual pledging conference on fighting the COVID-19 pandemic, where he announced that his country would be committing $1.3 million US. Meanwhile, South Africa's COVID stats show another jump in the number of confirmed cases by more than 400 for a second day. We now cross to Betty Dibia in Johannesburg to give us more on today's happenings.
Thank you, Laddie. More than 1 million South Africans returned to work today, although not all sectors are allowed back in business at the moment, and not all those who are back in business have everybody 100% physically present under lockdown level 4. Ahead of this, many interprovincial returnees made their way back to base at the weekend. We joined the Gauteng Member of Executive Council, or MEC, for Health, Dr. Bandile Masuku, at the tollgate screening session on Sunday evening.
The whole main aim of the operation is just to make sure that we screen everybody that is coming back into Gauteng. Also, the big objective is just to make sure that we also have got a sense of who's coming back, and also just to have a sense on their infections.
The government hopes it will all go smooth, especially health-wise, as it battles on several fronts, from those protesting against alleged inadequate PPEs to those accused of stealing food parcels, and then the big cigarette industry suing government for not reversing the ban on cigarette sale. They say their losses run into hundreds of millions of rands, while government insists it's still unsafe for the people. Meanwhile, more South Africans are expected back home this week from across the world. The government has evacuated more than 3,000 stranded citizens so far. And it's time for the long queues by social grant beneficiaries across the country. Another worrisome picture is that of people on very long food parcel queues.
These are people that's not getting food at deep threat.
South Africa recorded a surge in the number of confirmed cases over the weekend in the first 3 days of lockdown level 4. And now for today's figures, the number of confirmed cases has crossed the 7,000 mark. Number of recoveries is also on the rise, reducing the number of active cases. Unfortunately, more fatalities have also been recorded. Back to you, Laddie.
Thank you, Betty. The United Kingdom Health Secretary Matt Hancock has announced the start of a trial on the Isle of Wight involving an app to track and trace the coronavirus. Using Bluetooth, the free app tracks when its users come into contact with each other, automating the tracing process. If a user develops coronavirus symptoms, it is up to them to let the app inform the NHS. Meanwhile, the European Commission has launched a global effort to fund research on a vaccine and other tools to combat the coronavirus. In the United States, President Donald Trump said he is, quote, very confident there'll be a vaccine for coronavirus by the end of the year, revising up his estimate of the final U.S. death toll as several European countries prepare for cautious easing of lockdown. Mr. Trump in April predicted 60,000 American lives would be lost, but on Sunday said we're going to lose anywhere from 75, 80 to 100,000 people. That's a horrible thing. Our correspondent, Maria Bird, joins us now from Washington, D.C. Good evening, Maria.
Good evening.
This death toll increase, do you have any idea of what has made Mr. Trump think that the numbers are likely to be higher?
Well, the modeling that we've been using for the past few months now, and the most influential modeling, is showing now potentially even up to 134,000 deaths. And many people are asking, well, why now? Why was it that it was 60,000 and now we're all the way over 100,000 potential deaths as a result of COVID-19? And what they're saying is that it's the social distancing issue. I mean, as you look at the reopening of the U.S., they're saying that is going to impact what they thought would potentially be additional restrictions and obviously longer closures that would potentially have curbed the death toll rate.
Now, there's also the question of the U.S. preparing for a mass COVID-19 vaccination. And in that realm, there's also the COVID-19 testing for low-income families. What more can you tell us about that?
Well, the vaccine, they're very hopeful that the vaccine will obviously be able to be released sometime in January of 2021. But ahead of that, they're going to actually, once it gets through the second phase of trials, they will begin producing the vaccine. And so once the third trial is ending in December, they will then begin, assuming that everything goes well, begin to distribute the vaccine, allowing individuals to receive the vaccine. I think many people are believing and knowing that social distancing is becoming a real challenge for Americans. And so looking for a vaccine is going to be the real way to end and potentially stop the death tolls and obviously the increased cases of the contraction of COVID-19. And as you mentioned, the low income.
24 states, Maria, 24 states are reopening in spite of the increase in the death toll. Why are they ignoring that and reopening?
Well, many people are obviously looking at the economics. I mean, they're very fearful of the economic influx of the COVID-19 and the potential devastation that it's occurring. I mean, the healthcare system in and of itself, you would think that due to COVID-19 and people having to go to the hospital, you would see an increase in the economic plight of the healthcare system. But the healthcare system is drastically being devastated by COVID-19 because many elective surgeries and many doctors' offices and dentist offices are having to be closed as a result of COVID-19. So this is really an economic issue, which is why the U.S. is reopening. This has nothing to do with any other reason other than economics. And I think you briefly asked earlier about the low-income families. You know, people don't think about the fact that low-income families who don't have doctor's prescriptions or don't have access to proper health care and health insurance are not being given these tests. But we have found ways, and some states are beginning to offer free COVID-19 testing for low-income families.
Our correspondent, Maria Bird, thank you so much for that update from Washington, D.C. in the United Kingdom, and do continue to stay safe.
Thank you.
We end our COVID-19 update at this hour, this time. Thank you for being with us. My name is Ladi Akridoluale. Good night.